CEG aspires to be a pioneer in the field of digital healthcare so far. We have often heard about the new reports about the medical industry on the inconvenience and expensiveness of seeking medical care. Although the government has introduced a lot of policies in the medical field, but drawbacks of the industry have not been fundamentally solved. Therefore, it is necessary to vigorously implement medical digitization and conduct effective healthcare reform. In first-tier cities, healthcare disorder is not obvious, while in underdeveloped areas, policies are difficult to be implemented. Some of the prominent problems are identified in the following aspect. For patients themselves, it is difficult to transfer to hospitals across regions. Patients are prone to have their identifier screwed up or patient data wrecked, rekeyed, etc. While in the aspect of medical insurance, problems are also prominent. For insurance companies, insurance management costs are high and a lot of energy is spent on contract signing and claim auditing. The process of insurance payment is complicated and time-consuming because it involves many stakeholders. Most of these problems arise from the lack of standardized electronic health records and operational processes. It is these factors that make most of the office staff inefficient. CEG Health will generate great application value in the medical field. In traditional medical care, a patient's medical information is held in the hospital in which she receives the medical treatment, because prescriptions and medical cases are the fundamentals of a hospital, and the privacy of medical information and legal constraints. These factors make hospitals not easy to disclose medical information they have. Therefore, there has always been a problem of medical information flow and information leakage. CEG Health has the characteristics of transparent sharing and tamper-proof, which can guarantee the safe flow of medical data. In the aspect of EHR, a complete health history for individuals is of great value for accurate treatment and disease prevention. CEG Health can store and share this data in real time. When patients encounter life-threatening disease but are unable to describe their cases, through the relevant data in CEG chain, a fast information channel is provided for doctors. Storing electronic health record on the blockchain can also assign an identifier code to the patient so that the patient's data is always associated with their identifier, reducing accidents caused by unnecessary errors. CEG Health blockchain-based healthcare management system provides a decentralized way to manage permissions, authorization, and data sharing between healthcare systems. The goal is to protect every patient's rights of representation and right to know about the others' access to their health data. Patients are able to share these permissions on the blockchain to create a more automated method of data sharing for clinical and research purposes. Although the storage, location, and audit log for data are maintained in the blockchain, all healthcare information remains in the EMR system. Meanwhile, if authentic interaction is needed, the supporting software is also indispensable. Through the use of drug data as a way of test for proof of concept, the result of biomedical research will benefit from the fast and secure access to research data provided by the blockchain. Technical features of CEG-DEX in handling patients' medical data. CEG-DEX has the characteristics of safe, fast, and precise. For example, patients' medical data may be difficult to obtain at critical times because of moving, walking, etc. When a patient is suffering from a life-threatening disease and the patient is unable to inform the case, it is easy for them to lose a good chance of treatment. The introduction of CEG-DEX technology can revolutionize the way patients' data is stored and transmitted. It provides prompt information channels for physicians through data linking, thereby greatly improving the efficiency of treatment. Application scenarios of intelligent devices. CEG-DEX is entering various smart devices that allow patients to record and upload their own body data anytime, anywhere to obtain the fastest and most effective health advice, such as medical care, through the use of wearable bracelet to synchronize data with CEG-DEX chains, radio frequency identification scanners to achieve rapid transmission of medical records, biometric scanners to transmit through biometric signals to achieve rapid shared transmission between medical data and hospitals. Application scenarios of pharmaceutical enterprises. CEG-DEX will also provide health supply chain management in the pharmaceutical industry. The pharmaceutical industry is generally faced with a problem that can have their consequences for patients. The circulation of counterfeit of substandard medicines. CEG-DEX technology has been proven to have the ability to solve this problem. CEG-DEX system can simplify management and improve efficiency by creating a formal registry to track products and components at every step of the process. The development of CEG chain-based software for medical care purposes can ensure the transparency of components used to manufacture drugs, track drug distribution, and ensure the authenticity of prescriptions. In the United States, the Drug Supply Chain Security Act requires manufacturers to provide batch-level product tracking and production history in order to ensure the implementation of the Act introduced by the U.S. Food and Drug Administration. The transparency and traceability of CEG-DEX system is very necessary. Moreover, a CEG-DEX system can also be used to detect prescription drug fraud. recording every transaction related to drug prescriptions on the CEG chain associated with all stakeholders, manufacturers, distributors, doctors, patients, and pharmacists. In this way, any altering or the malicious modifications to prescriptions by either party can be monitored, as well as to combat counterfeit drugs, maintain the authentic health of the pharmaceutical market, and create a clean and fair environment of medicine use for patients. CEG health system will also include the storage of DNA-related data record. By using blockchain technology, CEG-DNA will create a DNA wallet for the safe storage of genetic and medical data. The data inside can be retrieved through individual private keys, and the CEG-DNA wallet can facilitate the medical and health service, the provider's safety statistics gathering and sharing of patient data, and to help pharmaceutical companies conduct drug research and development more effectively, which will be a major breakthrough in the future medical industry.